Hello once more to summertime and Hoylake veterinary surgery. And summertime always makes us think about kennel cough. Kennel cough because everybody wants to go on a nice holiday, and that leaves you the question of what do you do with the dogs? They go in the kennels, and the kennels require you to vaccinate against kennel cough. So just a little bit more information to get you prepared and make sure we get the best out of this vaccine. Kennel cough is a weird disease, and it's a little bit like the common cold. It's made up of two big diseases, a bacteria called Bordetella bronchoseptica and a virus called parainfluenza virus. But there's also lots of other little bits and pieces that can add on board, like a little bit of herpes virus or a little bit of E. coli. All these other little bits can add to the kennel cough. So a kennel cough vaccine will get you about 85 to 90% immunity against kennel cough. It's a live vaccine. And the reason that becomes important is because having had kennel cough vaccination, these guys can occasionally show a little bit of a cough or a little bit of a sniffle or a little bit of runny eyes. And the other thing is they can occasionally shed kennel cough for a couple of days after the vaccine. So when you talk to the kennels and you ask them how soon before they come in do they want them to have the kennel cough vaccine, some of them are saying 2 weeks. The vaccine manufacturers are saying 5 days as a minimum. Common sense says about a week. Now, speak to the kennels. Not every kennels will require you to have kennel cough because not every kennels is worried about it. Kennel cough doesn't just happen in kennels, but the reason we see more of it in kennels is because it's commonly in the summer, and that means that the air is still. And then we get a whole load of dogs and we put them in a small space together. And that makes it easier for one to pass it to the next one, to the next one, to the next one. This is what happens with a common cold. Wintertime doesn't give you a cold. Wintertime is colder temperatures. Everybody huddles together in houses. They pass the bugs on easier to each other. Now, you'll get kennel cough in other places. You'll get it at obedience classes. You'll get it at the dog minders. You can get it just walking in the park. Anything that gets you in close proximity to another dog can pass kennel cough. It is like a cold. It's spread by fomite. In other words, you sneeze, you let all these particles out, somebody else inhales them, and that gives them kennel cough. Now, the kennel cough itself, it's not a deadly disease. You get a big cough, you sound like a 50-a-day smoker. If you're vaccinated against it, the cough is normally short-term, lasts for about a week, goes away with some antibiotics. If you're unvaccinated against it, you're normally talking 3 to 4 weeks worth of antibiotics. Now, kennel cough vaccine is a pain in the bum to give. It's the one where we squirt up the nose. Most dogs are absolutely fine with it. Occasionally, we need to get a dog, take it out the back and get the nurse to hold it still while we drip the stuff up their nose. It's not the worst thing in the world. It's just that the dogs don't like being manhandled while we squirt stuff up their nose. Unfortunately, that's the best way of getting a good reaction. So that's all the information you need about kennel cough. We do see kennel cough outside summertime. We had an outbreak around Hoylake and West Kirby about 2 to 3 weeks ago. Hopefully it's on the way down, but the sun is out now, so it's going to go back up. And of course, kids are just breaking up from school, so everybody's going into kennels. It'll come back up again. If you're into kennels, give us a ring. Make sure you have plenty of time. Get your kennel cough vaccination done. Have a good holiday. All right, bye-bye.